Coronavirus numbers continue to climb tonight.
5 more South Dakotans have died due to COVID-19, including people in their 30s and 50s. Health officials confirmed more than 450 new cases today. The number of active cases increased to more than 4,300. The number of coronavirus patients in South Dakota hospitals stayed at 168.
As those COVID-19 cases climb in KELOLAND, some are taking extra precautions. In addition to getting vaccinated, doctors say wearing a mask is a safe and effective way to protect yourself and those around you. Now, there's been plenty of information on the internet and on social media claiming masks don't work. The medical community in KELOLAND strongly disagrees with that opinion.
Masks do work.
Masks do work.
Nobody likes masks, me included, but they are a way to protect the smallest children.
Tiffany Peterson is the director of infection prevention at Avera. She spent a couple of decades studying infectious diseases and how they spread. And she says it is frustrating to see and hear all the false information on the internet and on social media.
You will hear people say that they don't work because the virus is smaller than the pores in the mask. But virus aren't by themselves modal. They need a vehicle on which to travel. And specific to COVID, they use respiratory droplets.
Masks severely limit the amount of respiratory droplets being spread from our mouths. This animation from a Mayo Clinic study shows an example. In fact, researchers at Mayo recently did another study and found that both paper masks and two-layer cloth masks are effective.
Even just a simple cloth mask that is two-ply, it has both the effect of trapping a lot of the particles that could potentially be infectious when somebody exhales. It also has the added benefit of, as they're breathing air back in, that it does a little bit of filtering as well.
Sanford's chief physician, Dr. Jeremy Cowles, says if anyone has any doubts about the effectiveness of masks and social distancing, all they have to do is look at last school year.
When we did that last year for school, we wiped out influenza. We wiped out RSV. And we have the opportunity to wipe it out for one more year until we can get the vaccine to a point where we can give it to those school kids as well.
According to the CDC, about half the transmissions of COVID-19 are from people who feel just fine, but they don't realize yet that they are infected.